For injections, first of all, we have to be more specific. I'm going to assume we're talking about the joint, stuff that goes like directly into the hip. For those injections, there's basically three types. First, cortisone. There's HA or hyaluronic acid, which is artificial joint fluid. And then there's stuff like PRP or stem cells. And I'm going to lump those two together because they're basically kind of the same thing. So for the first one, cortisone is an anti-inflammatory and it will reduce the inflammation that's associated with the arthritic problem or whatever problem. It could be a labral tear, whatever. It will reduce that inflammation and it will actually reduce your pain symptoms. It's really good for pain management, but it sucks ass at what it actually does to your cartilage. So I don't like to use it that much. So then you have HA, hyaluronic acid. This is artificial joint fluid. Your joint synovium creates joint fluid, and HA is the artificial version of this. Adds more lubrication to the joint and it makes the joint function better. And if you compare HA versus cortisone, they both have about the same effect and they last for about the same time, but the HA has a slower onset than does cortisone. So, and it's way more expensive. And then the last one is PRP, stem cells. This is where we take blood and we spin it down and we take all the growth factors from the blood and we inject those back into the joint. Does the same kind of thing that HA does, but it's now all natural factors. It's way more expensive. So cortisone's down here, then you have HA up here, and then PRP and stem cells, which is uber expensive, but they all really function about the same and they offer the same amount of pain relief and they really work for about the same duration. People say that they will work for up to a year, but if you look at the studies, they work for about 1 to 3 months, with the peak being at about 3 months. And then after that, it starts to decrease. When all of these things fail and all of the other conservative measures fail, that's when you need to speak to a surgeon about potentially getting some kind of surgical procedure for your hip problem. Hip replacement, hip arthroscopy, it depends on what the problem is.